One of the other benefits that having this community impact report really affords us is it really allows us to capture the activities and the partnerships we have with our community. We have the whole continuum of care that we can bring to the community.
Hello, I have an appointment.
Using our community clinics as an example, we can bring students through this, different disciplines, learning from, with, and about each other while practicing and seeing patients to help serve our communities.
I'll just be palpating. Let me know if there's any pain or tenderness.
Ok, voy a examinar.
Can you swallow?
¿Puede pasar un poco de saliva, por favor?
The Hope Clinic at Rutgers is not only a place where we can give care to the Plainfield community that may be underinsured, but it's also a great place for students to learn. This is a charitable clinic, it's 100% free, and it's helping the Plainfield community. It's not only helping those that need it, it's also building that community between the Rutgers University as well as the people of Plainfield.
Seeing them walk out of clinic with their symptoms resolved, it just puts a smile on your face and you feel like you're doing something good.
I think it's imperative that we provide care to people that need it.
Partnerships are at the core of everything we do, to keep the patient at the center of the process. A couple examples of the partnerships we have with our community outside of our community clinics. Our physical therapy program has a relationship with the Newark Public Schools to provide physical therapy services for their students.
Doing good. I'm liking what I'm seeing.
Second example is with our speech language pathology program.
Tell me in a full sentence. I want to read. Okay, that was good.
Who've partnered with the Newark Public Schools to provide workforce development and clinical education professional units to the practicing speech language pathologists in the schools.